Aadielah, thank you very much for joining us. First of all, I understand you've just attended the Global Alcohol Policy Conference 2020 in Dublin. I wonder if you could share with us what the latest thinking is on alcohol policy and what works to control abuse.
Good morning and thank you for having us. Unfortunately, I chose not to go to Dublin because of the travelling issues around the coronavirus. But the discussions in Dublin basically reinforced the call from the WHO that they started in 2010, in fact, to say that there are 10 things that any country can do to reduce alcohol-related harm, but that there are 3 specific best buys, and that is banning alcohol advertising, increasing the price of alcohol. In South Africa, for instance, in 2018, the Deutsche Bank rated Cape Town and Johannesburg as 2 of the 5 cities in the world, the top 5 cities in the world, for the cheapest beer. So increasing price as a major issue. And then the third is that of availability, looking at the trading hours, opening hours, the density. So in a place like Khayelitsha, for instance, where the killing happened, and this is the 3rd killing in less than a month, people in Khayelitsha live within 3 to 5 minutes of a liquor outlet. That is legal and illegal outlets. Now, that's a serious issue. And so we would support the Minister in saying that the lives of South Africans matters. And that's why we do need to look at the liquor laws.
My understanding is that all of those great suggestions to increase the price of alcohol, move the drinking age legally up to 21, etc., are contained within the liquor amendment bill that has been stalled since 2017. Why is it not getting passed?
Well, that's the question we are asking, because the liquor bill went through a public consultation process in 2016. And so we had expected in 2017 for it to be presented to Parliament for its processing. So 3 years later, we are asking the question, if the world is saying that there are things that we can do as a country to reduce alcohol-related harm, like losing 171 people every day due to alcohol, why is government not moving this? We know that we've had a change in ministers, but we would like to ask the current minister, why is it that we are not moving on this bill if the public had already given their input into it?
And what do you suspect is behind the delay?
Well, we can only suspect, but we can safely assume that the liquor industry has been hard at lobbying to make sure that this bill don't go through. So, for instance, in January, they adopted a new code which they call around self-regulation. But self-regulation doesn't help. It can't work. You can't be the game player, you can't be the referee, and you can't be the game organizer at the same time. The liquor industry needs to be independently regulated. And we need to ask government, why is it that if international evidence shows that if they undertake these high-level interventions, that we would reduce the harm. In 2017, NEDLAC commissioned a study by Genesis Analytics, and Genesis Analytics clearly showed that the adoption of the Liquor Amendment Bill will save the country money and lives. So the question from our side to government is, why are you stalling it? Why is it that the evidence is saying that we can do this and save lives? 60% of women who is physically abused or who goes through gender-based violence report that the abuser used alcohol at the time of the incident. Government in last year made a commitment to intervene to reduce gender-based violence. Adopting the liquor bill, the Liquor Amendment Bill of 2017 will help that. 60% of drivers who is involved in car crashes test positive for alcohol. Why is government not adopting the liquor bill and looking at the blood alcohol content level as high-level interventions to stop alcohol attributable harm?
Absolutely. Two of the biggest challenges we are facing, car accidents and gender-based violence. Thank you very much, Aadielah Maker, coming to us from Cape Town there of the Southern African Alcohol Policy Alliance.